everyone. Good evening and welcome to week 6. If you would, hopefully everyone is doing well. Place your name and campus in the chat. Ensure that your name is on the screen as it appears on Fortis's roster. If it's not, please change it so that it matches. Just as a reminder, these sessions are recorded and they are viewed by the attendance administrators. You are expected to be on camera unless we're on a break or something. But in the event that something happens, that you lose connectivity or you have to use the restroom or something like that, place a message in the chat to me. Do not send it out to everyone. All right, so let's get started here. Welcome to week 6. We will turn on homework grades here after class tonight, but just keep in mind homework grades, you have to have that 78% minimum homework and key graded assignments, both for in order for them to actually count. First, you must meet the requirement of key graded assignments being at least 78% without rounding, not 77.99, not 77.88. There's no rounding. So make sure that we capture all the points that we can, you out, because there's no rounding. The grade is what it is. And so, in addition to that, when we turn on homework grades, that's just to let you see the effect of your homework, the impact of your homework on your score. So, after about a week, the end of next week, which would be the end of week 7, we turn the homework grades back off because we do know that you must meet that first requirement of making that 78% without rounding on those key graded assignments in order for the homework to be captured or considered. So just keep that in mind. So we are in week 7 here. Let's look and see where we're, week 6, sorry. Taking us too fast here. We are moving pretty fast. Like I told y'all, once we take that first exam, it seems like time just goes by really, really fast. So we're in week 6. We do have a quiz tonight. You do have NCLEX questions. Make sure you're capturing at least that 50, turn in that highest score. Commit to not turning in a score that's less than 78%. Every point matters. So then next week is week 7. We do have the unit exam number 2. I think week 7 is another one of those weeks. If you're taking multiple classes where you might have 2 exams on the same day or in that same week. It's usually that week 4 and week 7. In addition to that, it might be week 10 also. So just go ahead and be looking at your schedules, work, play, home, and all of that because it does kind of fall that way for most of your classes. Okay. And so I'm going to pull up my Kahoot here. Log in at least with your initials. You don't have to put your whole name. Looks like it's froze. Let me hit try to click refresh. So this first blank is a chronic disease, hypertension, diabetes, eczema, whatever, and then that medication. It could be any disease process or a broken arm or whatever is going on with the patient. Okay, so now we're going to look at the same information in a different way, but we want to hear from you. I'm going to let you tell me what to select here. Let's see. Can I pull it up? Let's do. Okay, I'm going to share my screen. Remember, it's the same information. Identify those main concepts that it's talking about. And then you tell me what to select here. This little bar out of the way. Okay. Read through and you tell me which one to select. I'll select whatever the majority wants me to select.
The second one.
So red, blue,
yeah, the blue.
blue. Okay. So why would you say, why would you not choose this one?
I don't think it's related to the years that they were built.
Because it's early on, is what, the 50s, when those buildings had the bad paint in them. So this year is wrong. So that right there is, you have to know that year. Remember lead exposure. And then we do know that manufacturing plants, they're supposed to emit their waste certain types of ways, you know, whether or not it's air or however they emit or get rid of their waste. But people that live in those communities, if there's a river there, they're at higher risk for chronic diseases happening to them, because even though they're disposing in proper ways, they're still finding out that there's some connection. Maybe they need to change the way they're disposing those waste products. But if their waste is emitted through the air in their communities nearby, they're seeing higher rates of chronic illnesses and neurological disorders. If there's a community that's nearby that manufacturing plant that has that river there, they're finding that same thing that's happening. So okay, let's see what it's gonna tell us. Okay, got that one right. Let's go to the next one. Okay, tell me what to select. Identify the concept. Then what is it asking you about the concept?
Blue.
Blue. Blue. Okay. So the concept is ethical decision making. Then it's telling us, it's asking us, what is the first step? It didn't ask what were some steps or what wasn't a step. It says the first step. Okay. You all are saying blue. Let's see. All right. So far, so good. Is there a safe occupation? This is saying there is no safe occupation or profession. I am hearing true. So you mean to tell me if I'm a secretary or if I'm a janitor or if I'm a nurse, I'm at risk for something not so good happening to me?
Yes.
There is no safe occupation. Okay. So remember primary, secondary, and tertiary. This one is asking
the green one. Green.
So what is primary prevention, primary interventions? What are they? Define.
Information, education as the answer we're choosing.
Okay. So
provide pamphlet information to the population, community health, the workers.
To what? To prevent something from happening or to see if something has happened?
To prevent.
To prevent. So primary is prevention. So yes, if we provide that education about whatever it is we're trying to prevent. So what is this? What is the blue one?
That will be secondary. No,
secondary.
Secondary, yeah.
Secondary, because we're trying to see.
To administer.
Screening. So if a person takes a TB skin test, why are we giving that TB skin test? Why did you take that TB skin test? To see if you have been exposed.
Find out. Yes.
So screening or detect. Okay. So if we're administering medications, which level is that?
Tertiary. The tertiary.
Got it. Something has happened. Broken arm. They have a back pain. Whatever it is, but we're administering medication, diabetes or whatever it is. We're trying to manage or maintain it. Okay. We said the green button. Let's see, how do we do? All right.
That one is blue.
Okay, so this is a true statement. So we're the nurse because you know we
True.
can be that occupational nurse. We can work in that industry, and this is asking us if we walk through and walk through and see where our patients are working at. Because remember, we're in the industry. Our patients are the employees that are working there. So we walk through and actually look and see what they're doing. Does that give us an indication that they're using proper body mechanics to see if they're using the proper equipment? You all say true. Let's see. All right. All right, here it is. Direct observation. We're that occupational nurse. What does it allow us to do?
Red and blue.
Blue, red,
Okay.
red and blue,
Work processes. It allows us to see what they're doing. And
blue.
then
Mm,
we said blue too?
yeah,
Yes.
red
Okay.
and blue.
And is that our final answer? Let's see what we got. Okay, yes, because you going out, you see, you because you could think, well, okay, they over in section B, they're doing this, but when you actually walk out, you're like, oh, they're this. It requires them to bend, to lift, to stoop down, to push or pull. So it does give you that visualization and more reality about what the person is actually doing. Okay, I'm gonna be quiet on this one. What you got?
Yellow and green.
Yellow and blue.
Yeah, yellow and green.
So everyone's saying yellow. So it does allow us to see, to identify if they're real hazards. You know, there's a rug, a non-slip rug that's there. It's torn or it's not there at all that's supposed to be there, or actual problems. Okay, so we say this one. Okay. Now, what else can we see?
The work practices of the employee. The green.
Okay. Okay, so the green one. So what does that mean? Okay, the person is supposed to be using this device to complete this task. So if we go out and look, we can determine whether or not the employees are really doing completing the task like they're supposed to be, like they've been trained to keep them safe. So we can actually observe their work practices. Are they completing tasks like they're supposed to? For example, if in the hospital, either the long-term care facilities, you know, we have those lifts. We have stand-up lifts, we have partial lifts, all different types of lifts. So are the employees actually using the devices that are made available to keep them and the patient safe, or are they transferring that patient themselves? That's what this is asking. Okay. The vision of various jobs. I'm not sure. Remember, some things are just placeholders. So we'll see. That's a placeholder. We know that one is. Let's see. Okay. All right. Let's see what we got. This indicates the patient is experiencing a learner-related barrier. So the main concept is what the patient's saying. Could this indicate that that patient may have an issue with learning what it is and understanding the information that we as a nurse are giving them? It could be
Blue.
discharge instruction.
Blue.
Okay.
Blue.
Okay. All right. Yeah, sometimes people say things and we're like, oh, just go ahead, just tell me, you know, whatever. We'll make statements. And it's because we really don't really understand what you're talking about. So is this another statement?
True.
That patient might be having an issue or a problem understanding the information that we're giving them. Okay. So when you read the question, you can paraphrase it, but don't change what it's asking. But just like I did, you know, this patient is stating, I will figure it out. Just tell me what is important. The person says that, are they really understanding the information packet that we've given them? I will figure it out. Just tell me what's important. Would you all say?
Red.
We say red? Okay, let's see. Why is it incorrect?
But
Because
that was positive. Can you go over that one?
okay, so if you're giving this patient, if we are reinforcing discharge instructions, remember that the RN has went in and gave the initial instructions. You're coming reinforcing. More than likely, we're giving the patient a packet. I will figure it out. They don't have to figure out anything. You're there to ask questions, to answer their questions if they have them. We've had 2 people come in and explain. They don't have to figure it out. A conversation has been had. They've been given a handout, hopefully in their first language. So usually when someone says, I'll just figure it out. Well, I'm here. We can have a discussion. I answer any questions that you want. If you didn't understand what the registered nurse came in and said, and you didn't understand what I said as the LPN, what questions do you have? So more than likely, this person has a learner barrier, a learning related barrier, because they're saying that. You understand what I'm saying? Because they've gotten 2 sets of instructions and probably handouts. Now they even let you look at these little videos. They don't have to figure out anything. You're there. So sometimes rather than feel embarrassed, they'll just say, let's just hurry up. Let's just hurry up. Okay.
Yes.
All right.
False.
Right.
No.
Mm-hmm. That person is actually, indicating they have other family members that have several family members that have whatever this disease process that's going on. So they probably are very knowledgeable, because if they know that other family members have that disease process, first of all, because most of the time people don't know, but if they actually know more than one person, they probably know what they're experiencing. Not that they don't want to learn more, but they just letting you know they have a foundation about that disease process.
False.
Okay. False. Okay, let's see. All right. Uh-oh. Trying to take it too fast. How can we, as the nurse, tell whether or not this person understands what they have read? These written instructions. We have these written instructions. We're providing them to this patient.
Red.
How can we assess or ensure that they understand? Everybody saying red? This is what you all said. Okay. All right. So having that conversation with them, that focused conversation. And then if they have questions, hopefully they'll ask. Okay. Would you share how you feel about that shouldn't be there, having hypertension, a broken arm or whatever, and having to administer med? Can the nurse gain more information?
True.
True. Let's see. All right. Uh-oh. Discharge. When does it begin?
True.
Okay, on admission. So even though it might, the resources that patient might need by the time they actually discharge, but we should start thinking about discharge once they come in, because they're not there to stay. So we should start thinking about it. Their primary healthcare provider.
Yes.
True.
Okay. Let's see. All right. The nurse understand that once the nurse understand, is it important? Is it priority that the nurse understand their personal feelings of working with members of any population? Is that important?
True.
True.
Okay. Think about what the word vulnerable means.
True.
True.
Okay. Person that
Yes.
vulnerable, someone's at risk for not so good results or bad results happening. That means that it'll happen, but they're at risk for, because they're vulnerable. We're talking about a vulnerable population. Is this true or false?
True.
True.
Yes.
Because they're vulnerable. Not to say that they will get communicable disease, but they're a higher risk for. Vulnerable population, again, have higher mortality rates than the general population.
True.
True.
Because the word vulnerable, they're at more risk for something not so good or bad outcomes happening to them. What about this one?
True.
Okay.
True.
Let's see. I think that was it. All right, so let's transition. Give me just a few minutes to finish so we can come on back. We're gonna save a break till the end, but we didn't need the entire 15 minutes, and that's okay. All right. So if the question asks you, which statement will the nurse need to provide correction? Which statement is incorrect? Which statement, which statement indicates the information needs to be retaught? So that statement that patient is making, if a nurse needs to go back and correct something, if it's a patient, even if it's a coworker, if someone's having to provide correction, having to go back and reteach it, more than likely that person or that patient is stating something that is correct or incorrect, if they need to be corrected. So if we need to correct our patient or our coworkers, are they saying something or stating something that is correct or incorrect?
Incorrect.
Okay. So when you read the answer choices, you're looking for something that is incorrect. Because if it's correct, it doesn't need to be corrected. So make sure you're answering what the question is asking you about the concept. So for those of you all that did miss, most of y'all missed that question that asked about needing a statement that needed to be corrected. You missed that part. So you're looking for something that was stated that was false or incorrect. Because if it's true or correct, it doesn't need to be corrected. So just test taking tip. Make sure that you're answering what they're asking you about the concept. Okay. Remember that for the exams, it does not give the partial points. So if it's a select all that apply, you must get all the answers correct. So make sure that you're taking the time. You have that 75 minutes. You have 50 questions. There will be math. There's always at least 5 math questions for the exam, but it is 75 minutes. The exam is in week 7. In the event that you need that exam proctored, don't forget about the 72-hour prior notice. Email should be sent to myself, whomever your instructor is, the Dean Brown, and the campus dean. Because remember, someone and a place has to be secured for you in order to take that exam on campus. All right, so let's go back to week 4. Special or vulnerable populations. We had pregnant adolescents. We had the LGBTQIA population. We had mental illness, alcohol, tobacco, and other drug problems. So let's just talk it through. Make sure we have an understanding. The word vulnerable there's a direct connection. If someone is vulnerable, it means that more than likely they are going to have, or they are at risk for some not so good or some bad results or something bad happening to them. So with that being said, I need you to tell me whether or not this statement is true or false. Vulnerable populations have good health outcomes.
False.
Okay. All right. Vulnerable populations are exposed to higher levels of crime and violence and communicable diseases.
True.
Okay, because remember, vulnerable, that means that they will, but because they're that word vulnerable, that means there's a direct connection with something not so good that could happen to that person. So let's talk about prenatal, postpartum, and long term. We're talking about the pregnant or the teen mom. So what's a long-term goal that we should have, or that teen should have for herself? What's something?
Education.
Education.
Completing
Go
an education.
back to education, yes.
completing the
For a
education.
better future for them.
Exactly. And not only the teen mom, if a person has any disease process that's going to, have them to miss a large number of days from school, their program's already out there. So we as that school nurse, we need to just identify and make our patients, which are our students and their parents, aware of, well, hey, you do have this option because a long-term goal we do want you to complete. It's very important that you at least complete your education. So let's talk about before the baby comes and after the baby comes. So we can just pick a week, 5 weeks, 6 weeks, 7 weeks, 8 weeks. What's our focus at that time before the baby comes?
Prenatal care.
What about postpartum? The baby is here. The mom has had a healthy delivery. The baby is here now. Postpartum.
The safety of the baby and taking care of the baby.
And what else? We want to find out what that
and understanding.
Okay. We want to find out what's that knowledge base of that mom has about taking care of that baby. What do they understand that the normal infant growth and development is? Because if they understand the normal infant growth and development, of course, hopefully they'll do the things so the baby can grow. And also, in the event that they detect or pick up on that the baby is not growing and developing like it should, then they will seek out care. So put things into context. We talked about teen mom. We talked about long-term goal. We talked about before the baby comes, that prenatal care. And then we talked about once the baby gets here. What is our focus at that time? Making sure that mom has a understanding or assessing what that understanding is. Therefore, we can identify resources that will, help that mom provide that best care for that baby. So lithium is one of those medications that are is a mood stabilizer. They give it for bipolar. And so true or false statement. We're talking about lithium. It's a mood stabilizer. It's given for bipolar. Should we encourage extra salt intake?
I know.
False.
Extra salt. No.
So we should encourage what kind of salt intake?
No salt. No salt.
Not no salt, not extra salt.
Low
Right there in the
salt.
middle. Normal, just a normal salt intake. Okay. What about if the patient is taking this medication or really any medications and they start to experience diarrhea, vomiting, lack of coordination, they can't walk around, they're falling down. What do we want them to report that, or is that more than likely that's expected from medications?
Reported as
Report.
That's some of the part a side effect, but it also needs to be reported to the physician so
Got
they
it.
make the decision to stop or change the medication.
Got it. Yes. And sometimes if our patients are combative, they may be having a mental health crisis. We want to refocus them. If they're having a crisis, if they are bipolar or schizophrenic, whatever the crisis is, they may just be focused on what they're focused on, what's reality to them. So they may be talking about things that are not true, but we need to refocus them when we're trying to collect that information from them. Because, that refocusing them, putting them, making sure the environment is calm and just refocusing them, just reminding them why you are asking them those questions. Because sometimes, if, we're going through a crisis, we're not thinking, clearly. And so we just know that we got this person talking about something that's not what I'm talking about. And so we have to refocus them and then provide that reminder as why you're asking them and trying to gather that information. Which, we're trying to gather the information so we can give it to the healthcare provider so they can decide, what's the best course of action, what's the treatment for them. So even though we're that school nurse many times you will be involved in helping completing physicals, whether or not it's doing those measurements, assisting with measuring the height and weight, checking those blood pressures. And sometimes even though a person seems to be underweight, their calorie intake is good. They're eating from that little plate. All the different food groups is nice and balanced. What is something, even though we've identified um that they are eating from all the food groups and they're eating everything like they're supposed to. So what is that when we have that conversation and we're asking them, well, what are you eating? Can you tell me, what you ate, for lunch? What do you usually eat for breakfast? Do you usually eat breakfast? How much water are you drinking? What information in a I guess a nutshell, what information is that? What categories that fall upon? We're getting their what? We're finding out about their what? What is all those food groups and meals and what you're eating? What does that fall up under? Think about it. We have a student. They're underweight. We've measured their height. We've measured their weight. We've calculated their body mass index. It puts them as underweight. So we do that focus, open-ended question. We ask about their meals. We ask about the food groups. What type of food items are they eating? What are we doing? What is that all about? We're trying to make sure that they do what? They're getting what? Not all the calories that they need, but all the what?
Nutrients.
The
Nutrients.
nutrients. Yes. So we really are doing that nutritional assessment because sometimes it based on that chart, I know that chart, that BMI chart, it's like, oh my goodness, it puts us way over here in the middle or over on either side, left or right. But once we sit down and have that focus discussion with them, asking about their food, how many meals they're eating, what their snacks are, then therefore, that might just be their weight and their height. And so they are getting the nutrients because we would be concerned if they were underweight and not getting their nutrients. Then because remember they're still growing, they're healthy, still growing, should be running, jumping, and hopping. So it's very important that they get those nutrients. So that we're really conducting a nutritional assessment. So another medication we talked about was Buspar. So side effects, everything has a side effect. You eat too many bananas, you have a side effect. So, but what side effects should we be reporting if someone is taking a antipsychotic or what's another class uh medicines for anxiety? What are some side effects? What's some side effects of those medications?
Dizziness.
Mm-hmm.
Sometimes they have lack of communication.
Lack of coordination is what you said.
Yeah, a lack of coordination.
Okay.
They can drive. When you take that kind of medication, you have to try it because you can, like a lack of coordination, then you can be focusing the thing that you have to do
Okay.
sometimes.
So sometimes those medications cause them to be drowsy. So yes, we want to report all of those symptoms. So if a person is taking a medication for anxiety, what should we see or what should indicate that that medication is therapeutic or is working for that person?
Their mood is stabilized.
Okay, they're less anxious. Exactly. If we're giving something for fever, if we're giving medication for fever, we should see that fever subside or go away or get better or decrease rather. And so if a person is taking medication for anxiety, usually they're anxious, the heartbeat, the heart rate is, fast, and so if they're taking medications for that, we should see that person's mood, their whole mood should be a little bit more calmer. They should be less anxious. So it's like what you're giving it for, you should see the opposite of that. Okay, we're giving it for anxiousness. So we should, if it's working, that person should feel less anxious and that their heart shouldn't be racing. Okay, so think about it in the reverse. Just like that question that we talked about initially, it asked about which statement should be corrected. So you're thinking about, well, which statement is incorrect. So you think about thinking about it in the reverse. Okay, let's see where we're at now. Let's see. Any questions so far? So let's talk about hospice, death, and dying. Okay. What if our patient just passed away, family members are there, and we go in, we've already done the postmortem care, and we're just needing information as to where to send the body to, with funeral home arrangements. What if that family just don't want to discuss it right then? What should we do?
Respect it. Give them time.
Give them time. It's okay to be silent. We can stay right there, but just, remain silent or only answer whatever it is or discuss whatever it is they're ready to discuss at that moment in time. So it's okay. They don't have to. We just need to give them time. Just remain with the family members without discussing those funeral arrangements. Once they get ready, they will they'll bring it up and they'll tell you, who's going to provide the last care for their loved one. But it's okay. I know that's the next thing on our list, but it's okay if they're not ready at that moment in time. Okay. And so, what are some things we need to think about? We have a client that's terminal and death is pretty close. We don't know when anyone's going to pass away, but based on the vital signs, the level of consciousness, we're saying that death is pretty close and they already have a terminal diagnosis. What are some things that we want to make sure that we provide for that client?
Comfort and
Comfort
manage
care.
pain in case they need it.
Okay, I heard making sure that they're comfortable as possible. Sometimes people are never
Yes.
pain free, but they're not moaning, they're not crying. So they're comfortable as possible. And I think I heard dignity. And then what's the other thing that we want to maintain? Their self-esteem. Self-esteem, dignity, and then making sure that they are as comfortable as possible. Making sure that we providing washing their face. Make sure we're doing that mouth care. Because usually at that when it's closer to death, the mouth kind of dries out, or sometimes the mouth they have the excessive secretions. Provide that care as needed. Don't wait if it's, if they're requiring care every hour for their, mouth to be suctioned out or cleaned or face to be washed or repositioned, make sure, and that's all preserving and maintaining that dignity and that self-esteem. And also it keeps them comfortable. It helps with their comfort. They're not, feeling like they're drowning in their own secretions. We're keeping that mouth clean. So hospice care, true or false, focuses on symptom management, but not comfort care. Hospice care.
False.
False.
Okay.
False. You offer
Because
all of that.
exactly. Hospice focuses on comfort care and symptom management. So that's the pain, the blood pressure, whatever it is. Don't forget the entire answer choice has to be correct. So if it's partially correct, that's not the answer choice that you want to select. So again, hospice focuses on symptom care, symptom management, and then comfort care. Any questions so far? So tell me about, looking at my chat, tell me about Cheyne-Stokes breathing. Kind of what words would you use to describe someone that is displaying Cheyne-Stokes breathing? Is it breathing even, unlabored? Is it deep? Is it shallow? Is it fast? Is it absent?
There, Shallow. Yeah.
Shallow. And what's another word? What is apnea?
Oh, that they stop breathing for sometimes. Like
Exactly.
they.
It's absent. So a certain amount of time, that chest will not rise and fall. So chain Stokes breathing is shallow, followed by periods of that chest is not rising and falling, and that means apnea. So shallow, followed by periods of apnea. That is chain Stokes breathing. And usually, like I said, we don't know when anyone's going to pass away, but usually you'll see that toward the end. Their respiration, their total respirations in a minute might be 5 or 6 because they have those long periods where they're not breathing, and that's called apnea. And so a lot of times, well, we're providing the education now, but usually at the end of life, someone's terminal and the end of life is pretty close. They stop eating, they stop drinking, but it's hard for us to see our loved ones not eat, and not drink anything. And so families, we will, request, well, hey, we need to get in here and do something to feed my family, my mom or dad or whomever it is. And so what information or what would you explain to that family about feeding and comfort at that stage? What does feeding foods do if someone's at the end of life and
It makes them uncomfortable.
it makes them uncomfortable because remember those body systems, they are shutting down. That natural death process is happening. And so those gastric secretions, they're not being secreted normally because those systems are slowly shutting down. So we will have to have a conversation, explain to those family members that feedings actually will increase that person, their loved ones discomfort. But it's like, we think, you would think, well, they need to eat something that would make them, feel a little bit better. So a coroner, they investigate deaths. And so what are at least 3 types of deaths that a coroner must investigate? So coroners investigate deaths where there might be a question as what really happened or the cause of death. So give me some examples.
If abuse was like, I'm not explaining, like, if they think like abuse was involved in the death,
Okay.
if it's not a natural cause of death, like old age and it just shut down, and then I forgot what the other one is.
Okay. So deaths from injuries, suspected suicides, and deaths of persons that are not under the healthcare up under a healthcare provider. So I was reading somewhere where they just I think it was the ambulance passed the vehicle and they saw the driver saw the person slumped over in the vehicle. So they stopped or whatever. But sure enough, the person they ended up doing, of course, CPR. And so they did CPR until they got him to the hospital. And so, of course, I'm sure that they would call the coroner in because this person did die. But what was the cause of what happened? So people, someone that dies that are not under the care of a primary healthcare provider, suspected suicides, and then deaths from injuries. Just trying to seek out what is the real cause. That's what they're trying to find out. Some places coroners are voted on, and some they are just they're just hired. Depends on, I guess, the areas, larger populations. And so that is a healthcare professional to just identify or bring clarity as the reason or the cause that someone actually passed away. Okay, so we talked about death being imminent or pretty close. We talked about those chain Stokes breathing, where they have those long periods where they're not breathing. Also, we will see that their respirations are irregular; they're not regular. Sometimes they will have that noisy breathing because remember I just said they will have those. Some people will have those increase in secretions, and that skin becomes cool, and sometimes it will even be clammy. So we want to make sure that we're keeping our clients as comfortable as possible, maintaining that self-esteem and that dignity, keeping them turned and repositioned, mouth care, making sure their body is clean. Okay. So what do we do if a patient they are receiving treatments, but then they say, hey, I don't want these treatments anymore. What should we who should
Find
we
out why.
contact?
Or their provider.
Respect them.
Okay. And then tell who. I heard you all say it. We can
The
ask the
provider.
question.
Mm-hmm.
That their healthcare provider, because they need to know, hey, they're not wanting this treatment anymore, and we respect that autonomy, but we do have to let that the healthcare provider know. Okay. All right. Any questions about death and dying? The coroner, make sure we remember those. But, why would they be called in? And the whole purpose is to identify, what was that cause of death. So there's not any, question as to why that person passed away. True or false? Children are less vulnerable to adverse health outcomes related to environmental exposures.
False.
And
Those are very vulnerable.
False.
why is it true?
Vulnerable.
What do children do? We're talking about the environment. What do they do on purpose? They fall down. Look, adults. We're trying to stay.
In there, at school, the germs, the virus,
They
everything.
touch everything. That's just what they do. They're even in relation to us in the ground or the environment. They're short. They're not tall like we are, so they're easy to touch the environment. So they are more vulnerable to adverse health outcomes related to environmental exposures. Like I said, they fall down on purpose. They roll around on the ground. I don't know if y'all remember doing that, but that's what children do. So they're at higher risk. If something's in that environment that could cause them harm, they're at higher risk for coming in contact with it. Is there a safe occupation?
And my water.
Is there a safe occupation? Is there a safe occupation?
No.
Okay.
No.
Okay. So we talked about going out, you being an occupational nurse, going to those different, you keep getting employees that work in Section B. What are those employees doing over in Section B? Everybody coming out here, they've injured their toe, their foot, their leg. What is going on? We need to actually go to that area and see and observe, are they actually wearing the equipment, using the equipment? Are that we provided them safety education? Are they doing what they're supposed to be doing? So going out to that work site to actually look and see what they're doing, it helps us to identify if there's some other hazards, potential or either actual hazards. And also if we need to reteach, because there might have just been a learner barrier there where we thought or they thought they understood, what was being taught, but they really did not. Okay. So children are more vulnerable to adverse health outcomes related to the environment. Is that true or false?
True.
Okay. So I did ask you the question again. Good. Because the first time I asked you about it, I used less. This time I use more. So make sure that you are reading the question and answering what it is asking you about the concept. So make sure you take time to read it. Okay. We talked about statements or things that people might say if they do have those learner related barriers. Just tell me what I need to know. I don't like to read. You know, what else? I'll figure it out. Things like that. If they're saying statements like that, more than likely there is some type of learning related barrier. It might be that they just didn't understand what you were saying. It might be that they can't read, or they can read and they can't read well. It may be that they're, whatever disease process that they have going on is preventing them to, gain understanding of whatever it is that we are, the information that we're giving them. So if we are the nurse and we're trying to assess to determine our patient's ability to comprehend and read, Would we give them printed instructions? And if they do have a problem with reading and understanding, would this statement from the nurse help allow the patient to tell us whether or not they have a problem with reading and comprehending? So the nurse makes a statement, and the nurse is trying to get the patient to tell, him or her, yes, I have a problem with reading and comprehending, or no, I don't. So where the way I'm going is sometimes the way we word things shuts the patients down. So we want to ask those open-ended questions and make sure that it's more focused, open-ended. So with this statement, allow the patient to tell us, if they have an issue with comprehending and reading. We have these written instructions, and we always have these written instructions. This little folder, this little paper stapled together, and the nurse says, we print these written instructions out for everybody. So I've got your instructions. I do know that some people, they find these written instructions helpful, and some of them can't stand it, for whatever reason that it is. It's too wordy for them. The print is too big or too large. Would this be helpful for you? With that statement that I just made, which I was talking to the patient, do you think that patient will, if they had an issue with it, would they say, did that conversation or that statement or that conversation create a barrier for that patient, or did it kind of leave it open for that patient to tell me whether or not they had a problem or not? What do you think? You think my patient would say, hey, I have a problem with it, or they wouldn't share if they really did, if I worded it like that? Do I need to say it again? Are you all there?
Can you repeat it, please?
Okay. So we got a patient that's going home. We're in the emergency room. Patient's being discharged. And I bring the patient these printed instructions. And I say, here I am. I got you getting ready to go home. Got these instructions for you. The doctor wants you to look at this information and follow what it says. You know what? I print these instructions out for everybody. Some people like them, and some people they don't like them. They have difficulty understanding what it's saying. They say that the font is too big or too small. There are too many words. Would this be helpful for you? If my patient had an issue with comprehending and reading, that statement that I just said, do you think they would tell me, be open and say, hey, this is helpful, or no, you're right, them people right, this is too much? What do you think
Yes,
that?
because you made them feel somewhat comfortable because you made it known that other people have problems with it.
Exactly. And so we do have to be careful, or be just mindful of our conversations, because we do have, just think about when people were talking to you and you just now, you didn't understand what I was saying. And so was my voice tone, was it aggressive, or did it leave it open for you to say, hey, can you repeat that again? So make sure when we're talking with our patients that our conversations are, that we're telling them the truth, we're keeping it real, and at the same time leaving it open for them to, be open and honest with us. Okay, good. So if we have a patient that newly diagnosed diabetic and they're having to give injections, and they're afraid of it. They just don't have that. Sometimes we lack self-confidence. And so with that being said, we need to explore the patient's feelings. You know, even checking, I use injections, but it could be checking their blood pressure at home. I just don't understand what those numbers mean when I look at that monitor. And so we do want to explore the patient's feelings, by asking them, can you tell me more? What bothers you most about those numbers that you're seeing when you check your blood pressure? Well, I don't know what they mean. I just know that, they're up there. And well, injections, I'm just afraid of that. Or I haven't practiced giving injections. So the whole idea is sometimes our patients they lack that self-confidence. And we just need to explore their feelings, to gain more understanding to seek out a solution for them. When does discharge planning begin?
On admission.
Upon admission.
Upon admission, okay? All right. So the patient in room 201 states, I will continue taking my medication. They've been put on, we'll just say antibiotics. Or what's the other thing, that those steroids, that little Medrol, that little dose pack. I will continue taking these meds until they're all gone. You know, I'm sure I probably start feeling better before then, but I'll take them all. Do we need to do further teaching for a statement like that?
No.
But what if that patient in 201 says, hey, taking these big old pills, it's the moment I start feeling better, I'm gonna stop taking these meds. Do we need to do further teaching?
Yes.
Okay, yes. Because we want them to start feeling better, but then they still need to know, well, hey, you need this entire course of medications, to fully fix, heal, whatever it is that you're taking it for. Okay, and it's just, having those conversations, and you'll get, gain an understanding, because they'll tell you, oh, I'm not gonna do that, or I'll do that for a couple of days, and that's it. And so therefore you can provide, reinforce the teaching. So I'm gonna pause here and ask, are there any questions about any of the concepts? Make sure that you go back through the classroom recordings and the exam reviews that are provided. I think we have some Kahoots out there too. I think Dr. Turney did those. So just make sure they're in the original announcement from week 6. So make sure you click each one of those little tabs. There are resources out there in different formats, because we know everybody don't learn the same. We have different learning styles. So we have all different types of ways of presenting the information to you. Let me look in the chat. Are there any questions? Okay. And then I did make note of some of you all were responding in the chat to some of the questions I was asking. That was good. So if first step in ethical decision making. I know we think we had that one on the quiz. What is that first step?
Identifying the.
Yeah, because how are we gonna fix something we don't know what it really is? So identifying what the issue is. And so yeah, that would be that first step, because we can't choose a plan, we can't evaluate anything, or we don't even know what the issue actually is. Okay. And remember, end of life, we're trying to keep that client comfortable. Adequate pain control, keeping that client comfortable. All those means the same thing. And so those things are just, worded differently. So the American Nurses Association, let's go back over that. The American Nurses Association does describe the standards of care. It defines our professional practice. And so it does not provide specific guidelines. So what happens is the guidelines are broad. And so when the different healthcare facilities, for example, we have urgent care, we have the hospital, we have the long-term care, it takes what the American Nurses Association has put out there, and it makes it the guidelines specific to that area, But so the American Nurses Association, their guidelines are general, they're not specific. But once a healthcare facility is developed and organized, then that facility makes their guidelines specific. All right. So there aren't any more questions. We'll take on our break, and then that will be the end. We do not return. And again, just make sure that as soon as this video downloads, I upload it. But make sure you go back to week was it 6, 5, and 4. Make sure you look at those recordings. Have a good night.